Hello, I'm Darlene Rouleau, Clinical Nurse Leader at Maine Medical Center.
And I'm Lauri Wilson, also a clinical nurse leader at Maine Medical Center, and we're here to present our poster, Zero Readmission Rates, Initiative to Standardize Education for Patients Going Home with a Tracheostomy or a Laryngectomy. In 2017, Maine had the highest incidence of head and neck cancer in the country and the second highest mortality rate. Overall, in the past 10 years, Maine Medical Center has experienced a 73% increase in our weekly rounding volume and an 8-fold increase in our patients being discharged home with a tracheostomy. With this larger volume of tracheostomy and laryngectomy patients, many nurses felt uncomfortable caring for this patient population and also lacked the confidence to provide home care education. The adult tracheostomy team recognized the need to standardize both practice and education to ensure quality outcomes and patient safety, both in the hospital and at home.
For our methods, we used an interprofessional team who collaborated to do this standardization. This included creating competencies and a quick reference tip sheet for the staff, developing both a tracheostomy and laryngectomy class that included both didactic and skills practice, teaching train the trainer classes, where participants practice teaching the skills, emphasizing the specific teaching points needed to provide patient education. Establishing standardized pathways to home called Trach Trail and Larry Lane, and revising the home care guide to reflect best practice in required patients to demonstrate skills. Lastly, we continue to provide follow-up phone calls 24 to 48 hours after patients are discharged home. This helps to identify potential problems early and rectify them, potentially preventing another visit to the hospital.
For our results, in the past 2.5 years, we have educated almost 300 nurses. There was a marked increase in their confidence level before and after the classes for both performing and teaching patients with a tracheostomy or laryngectomy. In respect to patients, Maine Medical Center has seen a zero readmission to the hospital for tracheostomy reasons in the last 2 years.
Other subjective results. Our program was recognized by the Home Supply Company as they found a marked difference between our discharged patients compared to surrounding hospitals, both in Maine and out of state. We have since collaborated with 2 other hospitals to share our program information. We also had a support person share a story about being home with her husband for a couple of days when he had a syncopal episode. She was able to successfully resuscitate him until the ambulance arrived. She couldn't re-emphasize more how much the training in the hospital gave her the confidence and the knowledge of what to do in an emergency situation.
In conclusion, standardization of education for both staff and patients may lead to consistent, safe care, both in the hospital and in the home setting. Increasing staff knowledge and skills for tracheostomies and laryngectomies also led to expanding placement of these patients within our hospital. Thank you so much.